Whoa. Well, please take a seat. Oh, all right. I didn't get walk-up music, so thank you, sisters, for the nice welcome. All right. Looks like we're all getting settled here. So good morning and welcome, everyone, to the Fairview Community Health and Wellness Hub 1-year anniversary celebration. All right. And for those of you I haven't met, I think I know nearly everyone in the room, but I'm John Swanholm. I serve as Vice President, Community Advancement for the system. So our gathering this morning is really a kickoff to a series of events over the week, promising dynamic experiences that reflect our shared commitment to health and well-being, and also our community's health equity. So today's brief program, during the program, we're going to hear from Fairview President and CEO James Hereford, St. Paul City Council Member Rebecca Naker, and our partners from the Hub, several of our partners from the Hub, including Minnesota Community Care, Dr. Sri is here, and many of the team, Tony from Sinai Foundation, and United Healthcare. Many of the United Healthcare team is here today, and Brett is representing them. In addition, I'd like to recognize our partners, special guests, and all of you who've joined us today, and like to give a special call out to Allison O'Toole and Megan and the team from Second Harvest Heartland. Where did Allison go? She's in the back there. All right. So Allison and the team have been helping to lead our food as medicine efforts for several years and partnering with Sinai Foundation at the Hub on site here. We also have the Office of Senator Tina Smith represented, the Office of Representative Betty McCollum, and also Office of Ramsey County Commissioner Rafael Ortega. Ken's here. So we would like to begin our program by sharing our land acknowledgement. And as you'll recall, many of you were at our grand opening a year ago where we had our first reading of the land acknowledgement. So I'd like to introduce Christina McCoy, our Manager of Community Health Equity Initiatives from our Community Advancement team, to begin our program. Christina.
Good morning, friends. It is so wonderful to have you with us. I cannot believe that we have been on this journey for a year. I am Christina McCoy. I use she, her pronouns, and I'm the manager of Community Health Equity Initiatives here at Fairview. And I was part of a cross-functional group that came together to develop our system's first land acknowledgement. We wanted to pay tribute to the original inhabitants of this land and really step into this new space with the best of intentions and making our commitment to our Indigenous brothers and sisters. And so with that, I would like to share with you our land acknowledgement. We acknowledge with respect and gratitude that the land on which we live is Indigenous land. Minnesota Makoche, Minnesota, is the homeland of the Dakota and Anishinaabe peoples and other Native nations, whose ancient relationships with this land continue to this day. We acknowledge that this sacred land does not belong to us. We are occupiers here who have also come to call this land where the water reflects the sky home. The Fairview Community Health and Wellness Hub is located downtown St. Paul, downstream of the confluence of the Minnesota and Mississippi rivers. The convergence of these waters is known as Bedote. This site is deeply significant to many Dakota people as the sacred place of creation. It is our understanding that Dakota has been translated to mean friend. We hope by acknowledging the land and the original stewards of the land that we may also extend our own friendship. We recognize that land acknowledgement is only a starting point. There's a complex history of genocide, broken treaties, including those of 1837 and 1851, and colonialism that has been concealed throughout history. We acknowledge the impacts of this history on the generations of the past and the generations of the future. While we cannot undo the wrongs and do not want to disguise the past, we must be forthright about the journey to today and thus take restorative action. We acknowledge that other communities have also been marginalized and exploited to generate the community's wealth over time. We commit to continued action and partnership with the community to address these injustices and to create and maintain health equity. Through the work of the Fairview Community Health and Wellness Hub and the mHealth Fairview Center for Community Health Equity, we hope to embrace the wisdom and planning for the next 7 generations on this revered land. We commit to strengthening our relationships in our community as a healthcare provider, employer, academic institution, and community member. We will partner and lead with our Indigenous and other marginalized neighbors in our efforts to care for current and future inhabitants of this land. With that, I will turn it over to Diane Tran.
Thank you, Christina. It's important to kick off today by acknowledging with reverence the history of the native land upon which we stand today, and the legacy of the caregivers and servant leaders who have laid a foundation for the work that we do within these walls day in and out. Welcome again, everyone. I'm Diane Tran. I use she, her pronouns, and I serve as the executive director of the mHealth Fairview Center for Community Health Equity, which is also co-located here at the Hub. I want to express my heartfelt gratitude for the continuous support of these efforts that you all are displaying. Many of you are returning attendees who helped us officially launch the Hub last year. And of course, we want to welcome new members to the fold as well who may be here for the first time today. Thank you for joining us to celebrate the 1-year anniversary of the Fairview Community Health and Wellness Hub. It's been a transformative journey that has led to the establishment of this holistic and culturally accessible hub. We began, as many of you know, by undertaking 2 years of extensive outreach, research, and community conversations, ultimately engaging thousands of employees, neighbors, and patients in this process. Through that process, we heard about the importance of providing care in trusted spaces, investing in neighborhoods as an anchor institution, and addressing social risk factors in order to care for the whole person and the whole family. We also heard an emphasis on the importance of meeting both current and emerging health and wellness needs in the East Metro community. Today, I'm excited to bring to the stage key partners in this work to provide a year 1 report so we can continue to keep accountable to our stated commitments and share with you about what's happening here and how you can continue to be a part of this evolving effort. So with that in mind, I'd like to start by welcoming James Hereford, Fairview Health Services President and CEO, to share a few words. Welcome, James.
Thank you, Diane. I saw you leap up here. I thought, okay, if somebody of your stature can do it, I can. So I made it up here without a hamstring pull. Welcome, everybody. My name is James Hereford. I'm the president and CEO of Fairview Health Services. It is really my pleasure to welcome you all here today. It's important that we mark anniversaries, and this is a particularly important one from my perspective. This represents a significant transition in so many ways about how do we fulfill our purpose as a healthcare organization. And I think everybody recognizes some of the challenges in our current health ecosystem and who it works for, and frankly, who it doesn't work for. And the whole point of the hub was to address some of the issues that aren't necessarily addressed in the main of how healthcare works in this country. So it's particularly gratifying to me to be able to sit and see all of you who have made such a commitment to this, believed in the vision, believed in the problem, and believed in the solution, at least the start of the solution. And I always think about the hub as a place that is generative in nature. It represents an important starting point, not an end point. That end point will be determined by all of us as we come together. And that is one of the things that I greatly appreciate about the hub. This is an investment in, but more importantly, with the East Metro and the St. Paul community. This was not done because we said this should happen. As Diane pointed out, there were literally tens of thousands of hours of conversation that went into this to decide, how do we do this? Where's our logical starting point, and where's the direction that we're aiming for? And that was done with a whole bunch of people, many of the partners who are going to follow me at the podium, but many, literally thousands of people who aren't in this room today, but who contributed to those conversations. So, I had a little note that they gave me about seeing the vision realized. I don't think that's it. The vision isn't realized, but the vision is started. And it's up to us to continue to further that vision, to further that effort, to be able to continue to lean into the very real problems and come up with creative solutions. And that's what the hub represents. So let me quickly thank partners. They only gave me 2 to 3 minutes, so that's, for those of you who know me, that's somewhat unnatural. 2 to 3 minutes goes very quickly. Let me thank our partners, many of whom are going to follow at the podium. Tony Sena and the Sena Foundation and Second Harvest Heartland, addressing food access and amplifying food is medicine, which I'm very proud of our organization, having been a leader in that. But also thinking about youth work development programs and how do we get our young people involved and engaged and seeing what is special about engagement in the community, helping your community, and seeing the returns that that represents. The Minnesota Community Care, FQHC. What a terrific organization, being able to provide affordable primary care and pharmacy access in this building. Frankly, they can do things that we can't do. Despite our extensive primary care capability, MCC can do things that we cannot do. And it represents, hopefully, our humbleness of saying, you know what, we can't be the be-all, end-all. There are people who can do it better. Let's reach out to them. That's what that represents. Certainly, United Healthcare, and Brett and your team have been unbelievable. Now, I will have my issues with payers at times. I will recognize that. And United Healthcare and their people looked at what we were doing, stepped up and stepped in and said, we want to help. And it wasn't a, oh, well, here's a check, you know, bon chance, bon voyage. It was they've been with us shoulder to shoulder, step by step, engaging the community, and continue to do just that. So thank you, Brett. Thank you, United Healthcare. And then at last, if certainly not least, are the Sisters of Carondelet. I'm going to start leaking up when I look at you guys. They're such special partners and such an important part of this. And what strikes me is, I mean, this is all because of them, right? What their order did in 1853 was see a community need. At that point, it happened to be cholera. And saying, you know what? We need to step in and do something that has not been done in Minnesota. We're going to establish a hospital. And that same energy, that same vision, that same compassion was realized as we talked about, so what's the next chapter? And they reached out and said, you know what? This is right. This is the direction. This is the next need. Let's get behind this and make it happen. And I can truthfully say we would not be standing here at the 1-year anniversary if it wasn't for you all. Thank you so much. So it does take a village in this state. In this instance, it takes a community. Our community is better because of the work that we've done collectively, and we're not done. So thank you for the efforts to date, and I look forward to continuing to be your partner and do the things that we need to do to address these problems. I want to say my final thank you for my team. All the people, all the clinicians, all the staff who have worked tirelessly and continue to do so to take an idea and take a lot of passion and energy and convert that into reality, to convert that into, you know, the actual impact on people. And whether it's our mini vaccination clinics or whether it's the things we do to package up food, our food is medicine, I mean, the list goes on. What we do from this building in terms of practical research in the community, there are just so many examples, and all of that is done by our people. I am incredibly proud to call them my colleagues, and I wish I could name them all. I can't because, as I mentioned, they only gave me 2 to 3 minutes. So thank you so much. Truly appreciate you being here, and thank you to all our partners and everybody that's been involved.
Thank you very much, James, for your vision and your insights and acknowledging the 2 to 3 minutes and really making good use of them. Thank you. It's my pleasure now to introduce Councilmember Rebecca Naker for the City of St. Paul, and we appreciate the Councilmember's support, fierce community advocacy, and particularly being a voice for young people. Welcome to this stage. Thank you for joining us today.
Well, good morning, everyone. It is really a pleasure to be here. Every time I'm back in this space, I'm reminded of the fact that I gave birth to both of my children at the former St. Joe's. And it's really, really nice to be in this building again and not be in labor. So I appreciate that. I'm really honored to be here. Those of us in the Jewish community just finished celebrating Rosh Hashanah, the Jewish New Year, and this is literally the first day of that new year, and this is the first appointment on my calendar of that new year, so I cannot imagine a better way to be kicking off a new year than with this one-year anniversary of what I consider to truly be not just an initiative, an organization, a hub, but an answer to a critical question that so many of us in our community are asking right now. And that question is, how are we going to emerge from this pandemic stronger? How are we going to address the challenges that continue to face us, right? The health effects, the poverty, the hopelessness, the addiction, the disconnection and the isolation and the loneliness that so many of us feel from each other. These are questions that are really at the root of so many of the day-to-day issues that all of us are dealing with and that my colleagues and I in the city of St. Paul are wrestling with every day. And while we have a number of tactics that we're deploying to try to make things better, I believe at the end of the day, the way that we are going to emerge from this pandemic stronger and more resilient is by going back to our superpowers as a city. And those superpowers, I believe, are our people, our diversity, and our connection with each other. It's that thick web of social capital, those networks, right, that make you feel like you live in a big city, small town. When you walk down the street, you're always going to see somebody you know, that unbelievably rich diversity in our community, the linguistic, racial, cultural, national diversity that we are so lucky to be home to, the caring for one another, that's just part of who we are. And to me, that's what this hub is. This hub honors and is that diversity, that caring, and that connection between us. So that's why I'm so grateful that this is located in the great Ward 2 in downtown St. Paul. Congratulations to Fairview and to all your community partners. Happy anniversary, and thank you on behalf of the city.
Thank you so much, and Happy New Year to you and yours, Councilmember Naker. I just want to be acknowledging of the fact that Representative Maria Isa Perez-Vega is also in the room, so I just want to thank everyone for your community leadership in so many different ways, and again, for taking the time to be here with us today. Now I'd like to invite to the stage Dr. Shri Umapathy, the Medical Director of the St. Paul Wellness Center at Minnesota Community Care. Grateful for their serving as the hub's pharmacy and primary care partner, and to be able to also hear from a provider perspective his insights about serving here at the hub with us. Welcome.
Good morning, everyone. As Diane said, my name is Shri Umapathy. I serve as the Medical Director of Minnesota Community Care, the St. Paul Wellness Center. I am not a good speaker compared to these two, so I'm going to get straight to business. So Minnesota Community Care is a federally qualified health center that's been in St. Paul for nearly 50 years. Our primary goal is to bring high-quality health care and health equity to underserved and marginalized populations. So our goals at the Wellness Hub are to improve the health literacy and empower the community to make more informed decisions about their health and well-being. I think we all can agree that if you just get out of people's way and take away obstacles, they are perfectly capable of taking care of their lives and improving their quality of life. So that is one of our goals. So here, what we want to do is, establish a long-term and relationship and trust with this community. We have been serving the greater St. Paul area for 50 years, and it's not because we are, highly profitable, or it's not because, we have the greatest team on earth, but it is because we, establish trust and a rapport with marginalized populations. And they feel like our clinics are second home when they are turned away from many other institutions. So at present, we offer primary care, chiropractic care, gender care, and substance use disorder clinic, and along with new retail pharmacy support downstairs. We are also working on bringing access to dental and acupuncture services in the future as well. So far to date, from last July when we had a soft opening to now, we have seen close to 6,500 patients. And out of those, we've had 3,005 primary care patients, 1,700 chiropractic patients. Gender care patients are close to 800, and our substance use disorder patients have been close to 560 patients. And we also utilizing the Veggies RX program, which is serving 20 of our patient families that are food insecure. We want to thank all the Hub collaborators for the important work you are doing for our communities, as the needs of our communities are multifaceted and multidimensional, to which your work is crucial in addressing. I am deeply appreciative and grateful for all the behind-the-scenes staff that have contributed to making the Wellness Hub a reality. Being at the Wellness Hub gives Minnesota Community Care greater access to programs that our patients desperately need. As I spoke about the Veggies RX program, which, as our CEO for Fairview said, some things we do good, some things we don't do as well. So we want to be with people who do that things better than us. So Veggies RX is a vital support for us. So thank you for the Sana Foundation and Fairview for including us in that partnership. The long-term well-being of a community needs to be planned with a holistic outlook. We believe that the Wellness Hub is an appropriate step in that direction. So thank you again for including us in this space, and we hope to be here for many years to come. Thank you for all your support. Thanks.
Thank you, Dr. Umapathy. Always smart to start off by saying you're not a good speaker and then wow the crowd, so well done. And now I'll ask Tony Sane to come to the stage, founder and CEO of the Sana Foundation, a key partner of ours with the Eastside Health and Wellbeing Collaborative convened by Fairview for over 8 years. And we so value your collaboration at the Hub and here at the Hub and at the new Health Commons located at Conway. So welcome, Tony. Thanks for joining us.
Thank you. I'm going to try to give you back one of your minutes. No, this is really exciting. So thank you, James and team, and John and Dan for all over the years, and really bringing everyone together. This is a big deal, and for us, it feels really special to be part of something. Like this isn't something like we're out doing. Like just seeing everybody here and all the organizations involved. We're part of something really big, and there is nothing bigger than community. So to be part of that and feel included, not only as individuals, but as an organization is really special. So thank you all for being part of it. With this, a year ago, we all kind of dove in with trust, and it was already something big, and it's gotten bigger. And so for us, through the partnership expanding with Health Commons East at Conway, and not just food like they talked about with workforce, it's been awesome, and Allison and your team being a partner, helping us, serve over 50,000 families, and 2 million pounds of food this year has been incredible. So, thank you. And obviously, the team's done an incredible job, and it's a long way from being a soccer camp. So I hope people realize that we are not just a big soccer camp anymore. And everything that we do really is about community health, overall community well-being, and that's why the partnership is so synergistic as we build trust with our community members that come in and allow us to do this work with them. It just feels really good to be in a room of people doing this together. So I look forward to expanding and keeping it going, and keep improving the lives of our community together. So thank you.
Thank you, Tony. Whether you're on or off the field, you are fast, my friend, so thank you. And so I'd now like to introduce Brett Edelson, CEO of United Healthcare of Minnesota, North Dakota, and South Dakota. We are so grateful for you all and your significant support in making the Hub a reality and your ongoing commitment to health equity for our communities. Welcome.
Wow, thank you all, first of all, for being here today. It's just incredible to look out into this amazing room that overlooks the Capitol with all of these incredible community members and individuals who represent us. So thank you for being here. But I think my first big thank you and appreciation has to go to Fairview. It's really unique that a hospital system would step up and recognize these really big problems and do something about it. I think many in the community admired these problems, but Fairview had a vision, I recognize it's not realized yet, but had a vision and did something, and you're standing in it today. The second really unique thing, besides just the hospital system stepping up, Fairview stepping up, is the way they did it. I've been so impressed with all of the listening that's happened throughout the community before a decision was ever made about how do you move forward, and also recognizing that it's iterative, it's not just a point in time, but this is going to be an iterative place. They listen and they continue to listen. And then to deliver those services with the most trusted community partners that are represented today. That's why it's successful, because the services are being provided by those who are trusted most by the community. And it's because of that vision and because of that process that we've been honored at United Healthcare to be along for the journey. And I have to, because they're sitting in the front row, acknowledge two of my colleagues, because Lauren and Portia have been doing a lot of work. And it's not just, as James said, giving a check. It's actually sitting down and understanding how can we make a difference together. And they've just been such fantastic leaders and visionaries that brought in some experiences in some other communities outside of Minnesota to do it right and to do it really special here. So a big thank you to you. So in Minnesota, as we all know, we're a very humble group of folks. But I would like to brag for all of the community partners in Fairview, because I got these statistics, which I just couldn't believe, and they've been referenced a bit. But I just want to pause, step back, and really think about these numbers, because they're just incredible. And I recognize the numbers are a destination, a way to measure things, that every one represents an individual person. But when you step back over the course of the year, it's pretty incredible. So today, 1,600 households are being supported through food each week by this facility. And this number, I actually had to ask John if it was right. 100,000 pounds of food are being distributed every week from this one site. And Allison, that may not be a big number for Second Harvest Heartland, but at one site, that's a pretty big, impactful number for something that didn't exist even a year ago. Dr. Shree talked about the number of appointments, 6,500 appointments through Minnesota Community Care. There's also probably another 1,000 more through behavioral health that Fairview's providing directly. And then back to the food, what I love about the process, it's not just providing it, but it's how the fresh produce gets there. There's over 50 BIPOC-owned farms that are contributing, and then the food is being purchased at fair market value. So it's just, again, the process that's being used, not just the outcome. So thank you again for allowing United Healthcare to be a part of the process. And because we know we're not the destination yet, we'll look forward to the 2nd, 3rd, 4th, 5th anniversaries around this time in the years to come. Thank you.
Well, thank you so much, Brett, for all the support and partnership. And we'll get those save the dates out here for the subsequent years to come. Well, I want to thank all of our partners who are here. Certainly, as we think about the quarterly and monthly meetings to help build the work and programming, the interconnections here, the trust that's needed to bring partners together. I also want to recognize other partners who have been at the table who are sort of part of the Fairview family, including our Bethesda Long-Term Acute Care Hospital, our Mental Health and Addiction Care Services, Ebenezer with the Daybreak programs, and the recently opened Integrated Care and Rehab. So shout out to John Lundberg in the back of the room. Thank you for your leadership, John. And of course, Fairview Frontiers, James referenced earlier. I also want to recognize that we have our co-occurring 1-year anniversary of the mHealth Fairview Center for Community Health Equity. We are excited about the opportunity to continue to scale and spread programs to advance equity-centered, culturally responsive approaches to addressing community health. So in this past year, in this room even, we've hosted or co-hosted over 100 events, convening a Heal the Healers Summit with Indigenous Roots Cultural Arts Center, a regional health equity innovation summit with the American Hospital Association, and hosted a community immersion experience during the National Accelerating Health Equity Conference in May. We've also had international groups from England and Germany tour the hub to learn from this integrated model and approach right here in St. Paul. The center has also advanced work to build trust and connection for communities that may understandably mistrust research and would value direct engagement and information to ensure that their communities are represented in these new innovations. And so in partnership with Fairview Frontiers, and I see Andrew in the back of the room there, the center helped to increase the enrollment of BIPOC populations in clinical trials, doubling from 15% to more than 30% in this past year. And the center is glad to be advancing 3 social determinants of health initiatives, including, as you heard, food is medicine, housing is health, and connection is cure. Our food is medicine programs currently offer healthy food in 40 ambulatory or acute sites across Fairview and, as you heard, at Minnesota Community Care, which we purchase in alignment with our anchor mission from over 50 BIPOC and underrepresented local farmers. Our Housing is Health initiative includes participation in the inaugural cohort of the Greater Minnesota Housing Fund's Housing and Health Equity Fellowship, and our Connection is Cure initiative with the National Institute for Health Improvement's Trustworthiness and Healthcare Prototyping Network. We're glad to be learning and leading in concert with others to ensure that we're addressing social risk factors, building trusting partnerships, and advocating as a health system that advances community health equity. And we hope that you will continue to join us in these and other efforts. So with that concludes our program officially today. I also want to shout out Ruben Moore in the back of the room with Minnesota Community Care, and then to acknowledge, again, the sisters who have laid this foundation upon which we can continue in this day and age to serve and care for the dear neighbor. So, as we said, it's important to celebrate. We hope you can join us for the next few days of programming and immersive experiences at the Hub. Thank you again for joining us, supporting us, and celebrating with us. Please help yourself to refreshments and the opportunity to connect with other leaders such as yourselves in the room. Thank you for being here today.